Hello everyone, Dr. Sam Schroetke here at Physical Therapy and Hand Clinic of Hillsboro with Technique Tuesday. And today we're going to do an exercise that we don't use much in the clinic, but when it's needed, it's very effective. So this is going to be for people who have back pain, and it tends to be one-sided back pain, but not always with this one. And they might have just back pain, it might run into the butt, into the hip, or possibly all the way down the leg, okay? And if you've tried some of the previous videos where we're talking about the extension and standing or the extension and lying where you kind of do the push-up one, if those were not helping or perhaps even making you worse, this one might be one you should try. Okay, so this one is called flexion rotation in lying. Flexion rotation in lying. Okay, and here's how it goes. So for this particular case, we're going to say that I have right-sided, say, back pain and into the buttock, okay? So eventually you're going to be laying on your right side, but to start, laying on the floor is fine. Bed might be too soft unless you have a firmer bed, but you're going to lie on your back. Remember, my pain is on the right side, so I start on my back. I bring my hips up, or my knees up toward my chest, bending my hips to about 90 degrees, maybe even a little more, and then I let them fall to that painful side. What I can do then is with the same side hand, so right hand, I can hold my knees down, and then my other hand is just laying down here, and I'm trying to keep that shoulder, that left shoulder, or the opposite shoulder, flat. And all you do is lay here for 30 to 60 seconds, and that's it. This is flexion, rotation, and lying. I'm treating right-sided symptoms, so it's my right side that's down toward the mat. Okay? Let's just run through that one more time. Okay, so you're going to start on your back, feet together, knees together. I didn't say that the first time. You're going to bring your knees toward your chest, going to about 90 degrees, maybe a little beyond, and then let them fall, let your knees go over toward the right side. Okay? With that same side hand, if you need to, if it feels like it's an intense stretch, then you can probably just lay here. Okay, I'm trying to keep that opposite sided shoulder down on the ground. If you want to give a little overpressure, or to hold your knees down, say they're coming up, and you can tolerate it, then with this other hand, you can just apply a little pressure here to keep them down, and then here I am, okay? Holding this for 30 to 60 seconds. Sometimes, if it's uncomfortable in the back, you can change your hip position. Some people like their hips to be flexed a little bit more. If that's more comfortable, then go for it. You don't have to, but you can play around with where your knee position is, where your hips are flexed in order to make that more comfortable for you, okay? 30 to 60 seconds. All right. Flexion, rotation, and lying. It's important you have the side that is painful, that is down. 30 to 60 seconds every 3 to 4 hours or 2 to 3 hours or is needed for pain. So we'll say 30 to 60 seconds every 2 to 3 hours for most people. Okay? All right. I'm Dr. Sam Schroetke here at Physical Therapy and Hand Clinic of Hillsboro. This is Technique Tuesday. Please like us on Facebook, like the video, subscribe to our channel, ask questions, and we will get back to you. As with anything, talk to your physical therapist or physician before performing any of these exercises to make sure that they are appropriate for you. And when you do the exercise and get up, you should be feeling better. That's a key that it's likely a good exercise for you. All right, thank you.